Hey everybody, Tim White, clinical specialist here with the Aspen After Surgery Center. We are here today with our latest patient, Lucia.
Correct.
Who is going to be shooting a video with us today talking about her history of breast cancer, breast implant capsular contracture, her treatment here at the Aspen After Surgery Center. So Lucia, thank you so much for being here and doing this. We know it's super weird to come on camera and talk about something so personal and so intimate. So we always thank our patients for going out of their way, especially with dealing with something so serious as cancer and then the aftercare and all that. But here we are today. You're graduating, right?
Yes, today is my final day.
Final day. So today is an assessment where we look at the overall course of how Lucia did with her treatment, clinically evaluate it, look at it scientifically, and be able to say, how did you do with both your opinion, right? So we ask you, how do you think you did? And then we objectively measure patients based on certain metrics, and you did really, really well.
I feel really, really good. I had no idea that I would be able to make this kind of progress. I remember saying to my husband, you know, I just hope after all this work that we're putting in that it pays off, and it paid off, I think, probably more, even more than we had hoped.
It exceeded your expectations.
It absolutely did.
Which is why these videos are so important, because we want to be able to provide real feedback to the community of those looking for solutions for breast implant capsular contracture with real patients. You are not a social media influencer.
No. I don't even do
You are not a
media.
paid testimonial.
No, not at all.
I did not give you any incentive to do this video.
No.
I'm legally obligated to tell the community of our viewers if there's any secondary gain. This is a real patient with real results, so we like to get that out there. So let's talk a little bit about what caused you to be here. Your family had a history of cancer. You were diagnosed with it, which then put you into the breast cancer cycle. So tell us a little bit about briefly kind of how it started and what happened.
Yes, my mother died from breast cancer. She was 57. My youngest sister, 59. My youngest sister died at 37. My other sister was diagnosed at 48, but she had the mastectomy and she was fine. So they had been looking at me for it, just tracking me. They did genetic testing and nothing showed up. I've been getting MRIs every year along with the mammograms, probably from 2003. And they would periodically take out, you know, they did biopsies in it, but they never came up cancerous. They were close. Finally, in 2021, it turned cancerous, and they said the best thing is to just take it all off. So
Gotcha.
So I ended up with implants.
So prophylaxis, prevention, doing something in advance in order to prevent something worse. So then you go through your whole course, which, refresh my memory, did it involve radiation?
No,
or chemo?
I did not need anything.
No?
I'm on a hormone blocker.
Right.
For the estrogen.
So what they essentially did was work, remove breast tissue.
Correct.
You had an implant placed inside there. And then after the whole final process of final implant, you noticed how long after that it either became firm, high, tight, or hard?
You know, it took me a while to feel healed, so I would say it was probably maybe a year before I decided that it just was different. I mean, I just thought it's just not healing as well, but after I think probably a year, I thought, you know, it's not right.
Right. Would you say at 3 months it was different? You knew something was going on, but you couldn't quite say because you thought, well, it's pretty soon after surgery, it's probably the way it's supposed to be.
Yeah, 3 to 6 months maybe, and I'm also right-handed. And I wondered if, you know, since I'm always using my right hand, if it had to do with that.
Right.
So I thought maybe it wasn't right. I would maybe closer to 6 months. I was pretty sure it was not right.
Right. So those are two really good points that I want to talk about. Number one, you didn't have radiation, but for anybody watching, if you have a history of radiation, it's the #1 trigger or exacerbator for breast implant capsular contracture. So you know, as part of your medical course, if you have radiation going into this, our treatment can also be done preventatively. So speak with your surgeon about it and say, you know, I know we're doing a reconstruction. I know radiation can be a complicating factor. can we discuss the Aspen after surgery treatment? Because we can see after surgery 2 weeks and do a course of treatment that will help prevent from even getting to the point. Now, that's not your case because you didn't have radiation, but for those that radiation do. Second thing, right hand dominance. There's a body of evidence out there, but right-handed, left-handed, that does not correlate with capsular contracture, even though it's a good kind of, thought process. Right or left, it has nothing to do with it because a capsule is immune-based. And whether you're right or left-handed doesn't affect how your autoimmune system basically rejects the capsule. Because for those who, maybe this is your first video, I show this all the time, this is essentially your breast implant, right? So this is what goes in the body. And about 3 days after this surgery, this pink shell, it's just a balloon that I cut the tip off of. Don't tell anybody. Trade secrets. But this very medical model that is very unique and explanatory to a capsule, it's a balloon, is basically what happens. So this shell forms around your breast implant, and this shell, which has kind of like fibers to it, begins to squeeze on itself and contract. And when it squeezes, it causes the implant to go whoop, right up, get hard, tight, sometimes painful, not always painful. Right. So another big myth that we're going to bust today is severe contracture is painful. That is not true. Some of the lowest grade capsules we treat are painful. Some of the most advanced capsules, grade 4s, have no pain at all. Pain is not an indicator. The two biggest things that we look for in contracture is one or both implants sit higher than each other, and when you squeeze them, right, so if this is the encapsulated side, I can barely sink my thumbs into this versus the other side, I can almost touch my two thumbs or fingers together. That's contraction, and that's what you had. So you basically encapsulated after about a year. You're like, okay, now, something is definitely not right. So you kind of went through the process of doctors, medical community, oncologist, so on and so forth. You didn't really get a solid solution, so you kind of had to do your own research. Correct. I think we mentioned family members may have been involved, or Google, and you ultimately came to us. So let's show exactly what's going on here. So your contracture on your side caused your affected implant to be about 1.0 centimeters higher than the unaffected side. Height and how we measure this is the #1 way that we can scientifically prove that this is a contracture, so long as the second criteria met, which was firmer. So if it's high and harder, it's almost always capsular contracture, okay? Nobody makes hard implants, by the way. There's no manufacturer out there that makes a hard implant. Myth #2, the implant is bigger, which is why it's harder. Incorrect. No surgeon on the planet lets you out of the operating room without looking for symmetry and perfection. It's part of their process. They actually lift the bed that you are on in the operating room. They lift you up. They look at you. Some of them even take pictures of you and go, Lucia is perfect. We're letting her out of here. Otherwise, they wouldn't. It's not the size of the implant. It's not the type of the implant. They don't make hard implants, okay? It is capsular contracture. So we need to be honest about what's going on, because unless we have a proper diagnosis, we can't treat you. Lying, cheating ourselves, listening to other people say it's not a big deal. Here's this medication that doesn't work. Here's this massage that we know won't work. Do something about it, which is where we come in. We provide a scientifically based treatment in order to help you get a result. And you did. So let's be scientists, right? Let's use research method to be able to validate how you did. So I'm going to give you 3 categories that anyone with contracture, we use this to assess. So if we say the softness of the breast now that you are discharged from 0 to 100% softer, what would you say it is?
I would say 90%.
90%.
I mean, it just feels so much better.
Perfect. On the it was uneven scale, from 0 to 100%, more even or looks better, what would you give it?
I didn't think it looks-wise, it was kind of more misshapen than it was up, and it was up a little bit. I mean that's probably maybe 80%, because I just didn't notice that as much.
It was very mild.
Yeah.
If you look at our measurement photo, you'll see you did not have a very huge distortion. We have patients with 4.8 centimeter distortions. So they're basically 4 to 5 times more lopsided than you are, which that's just the, there's no doubt that there's something wrong, because you essentially could be part of the community that we call the walking wounded. The walking wounded are very low-grade capsules with mild distortions that patients say, I don't even know there's a problem. I never knew there was a problem. And here we are, you know, I'm at a doctor's visit, or for some reason, this tightness or something going on, or a girlfriend of mine has implants and somehow, you know, I gave her a hug or she gave me a hug, and well, that's not right. And then you're like, okay, now I'm going to look into it. But the walking wound may not even know that they have a problem. So you, I guess, fortunately, were a lower advanced stage of contracture.
I think, yeah, you know, pain-wise, that was hard.
Right.
That was the worst.
So even in patients who have pain, from 0 to 100% less pain, what are you now?
Oh, I'm definitely 90% less.
90%.
The pain was the problem, the hardness, the stiffness.
Right.
I mean, I reached a point, I was supposed to see an oncologist, I think, last February. And November, we were getting ready to do a workout class. And it almost felt hot, like it was inflamed. I didn't have a fever or anything, and I just said, I'm done. And I called her up and said, I need to come in and see you.
And this becomes another problem because this capsule is living tissue. Think of it like a skin. It has its own blood vessels. It has its own nerve endings. So when this capsule tightens and it squeezes on the nerve, you get pain. But not everybody gets pain, right? The second issue is you go to your clinical team. My breast hurts. Well, the MRI doesn't really show anything. The X-ray doesn't show anything. You're okay. Here's some gabapentin. Here's pain medication. Here's all kinds of things that will never resolve the problem. Who wants to be on, you know, toxic medications your whole life, when the reality is this capsule no different than a knee after surgery, a shoulder after surgery. Scar tissue builds up, we need to break that down, and then the pain goes away, the range of motion comes back, the softness comes back.
Yeah,
so.
range of motion, that was also
Did you have any limitations?
I did not have any limitations, but there were certain things I, you know, just like, okay, I was afraid to touch it.
Right.
Because it felt like that balloon, but really like it was just going to burst.
Right.
It just felt so hard and tight.
Perfect.
So I don't think that perspective I didn't, but there were just didn't want to move it.
Right.
In general.
And there's lots of symptoms associated with this. So anybody watching this right now, comment below and say, this is what my symptom was, or what is this symptom? Is this potentially something related to capsular contracture? Even if it's not, we might be able to steer you in another direction of, hey, go see, go talk to your surgeon. But if it is a potential symptom that you're having, so anybody with breast implants watching this, if there's anything odd, tight, pain, uneven, misshapen, looks too big, looks too small, that could be related to contracture or other, comment down below, let us know what you think. We'd be able to share that type of you know, information with you, to where if we can't solve it, we can lead you in a direction where you can find a solution, because that's what you did. You found a solution, you came here, and now we're good. So what happens to Lucia now that she's treated? Well, the reality is you're going to be good. You'll be able to live your life and never have to deal with this again. But we taught you something that in rare cases, this can be triggered again and come back, right? So we talked about certain stretches to do, but you're not on any lifetime program. You do not have to continue to massage for life. You do not need to keep coming back here. You basically enjoy your life, you know, pain-free, and not have to deal with this anymore. And if, God forbid, one of those super rare triggers happens again in the future, jumping it right away, we can knock it out early, so it's not really a big deal. So congrats on your success.
Thank you so much.
Is there anything else you think an individual seeking either reconstruction or even cosmetic augmentation would want to know or hear from you related to
I would say the best thing is just jump on it right away. And, you know, I think that I would have probably my course of treatment might have been a little easier if I'd come in sooner, certainly missing a whole year of pain if I'd come in after a year. So I think at this
you
first
wish you would have done it sooner?
I wish I had done it sooner. I think that's the best advice I could give, is as soon as you feel like something's not right, to take care of it.
The capsule is like glue or cement. The longer you wait, the more it hardens, the less likelihood of the best outcome. So we don't know, but we do know the guarantee. If you are suffering from this condition, do not wait. Waiting could compromise it. Don't worry about the medications prescribed. Don't worry about the massages. Don't worry about the vitamin E. None of those things have any solid evidence, and I've never seen any of them work. Actually, there's lots of online forums right now that are plastic surgery forums. You can go into those spaces where they talk about contracture. There's a 1,000 individuals in there, all talking about the miracle asthma medication, the miracle drug the doctor prescribed, and then when you go into those posts, none of those posts go ghost because nobody ever got a result or an outcome with them. They're not FDA approved. They have no FDA indication for capsular contracture. I've never seen them work, and even worse, they have liver toxicity side effects, suicidal ideation, all kinds of dangerous side effects to take a drug that's not even meant to work. And we all know through science that massaging, unfortunately, does not treat or cure contracture, which is why our program is a combo of unique technology that we designed, therapeutic interventions, hands-on skills that we actually took out US patents for because they're so radically different and necessary in order to be able to help you get a result. So, Lucia, thanks.
Thank
We
you.
appreciate it. And congratulations.
Thanks.
For doing so
well.
Thank you. Anybody watching, again, please help the algorithm, help get this to other patients who are having contracture issues. Subscribe to our page so you get updates, new videos. Share with your friends, share with the medical community, share it with your plastic or cosmetic surgeons, and especially your reconstructive surgeons out there. Like it. You guys know the routine. And Tim Wyant signing off.
Thank you.